Welcome all of you. Today we are discussing porphyrias. So what are porphyrias? Porphyrias are rare group of genetic disorders that are resulting from deficiencies of enzymes in biosynthetic pathway of healing that leads to accumulation and increased excretion of porphyrins or porphyrin precursors such as ALA and PBG. So ALA is aminolevulinic acid and PBG is porphyrin. So basically you have to know what is heme biosynthesis and the deficient enzymes in the pathway of heme biosynthesis that lead to these genetic disorders. So we'll see what is sideroblastic anemia. So this is occurring due to enzyme deficiency delta ALA synthase, and where this delta ALA synthase is required. So this is required for the first step of heme biosynthesis. So succinyl CoA combines with glycine to form delta aminolevulinic acid. Succinyl CoA plus glycine, it forms delta aminolevulinic acid, and this step is catalyzed by delta ALA synthase. And when this enzyme is deficient, delta ALA synthase is deficient, that leads to very important disease called sideroblastic anemia, and this type of anemia is erythropoietic type, so erythropoietic porphyria, and this is X-linked recessive disorder, X-linked recessive porphyria, and the clinical features are anemia. So anemia is the clinical feature. Next important porphyria is plumboporphyria. Plumboporphyria is hepatic type of porphyria. It is autosomal recessive disorder or autosomal recessive type of porphyria. This occurs due to the deficiency of enzyme PBG synthase. And where this PBG synthase is required? This PBG synthase is required in second step of heme biosynthesis. So two molecules of delta aminolevulinic acid in presence of PBG synthase that forms PBG. PBG means porphyrinogen. So if this PBG synthase is deficient, aminolevulinic acid, delta aminolevulinic acid cannot be converted into PBG. So this leads to a disorder of porphyria named plumboporphyria, and this is hepatic type of porphyria and autosomal recessive condition. So the clinical features are abdominal pain and neuropsychiatric illness. Now we are discussing very important, that is third important type of porphyria, that is acute intermittent type of porphyria. So it is again hepatic type of porphyria, and mainly this type of porphyria is autosomal dominant condition. So we have seen previous two porphyrias, but this porphyria is autosomal dominant type. So this occurs due to deficiency of enzyme hydroxymethyl synthase. So where this enzyme is required? So this enzyme is required in third step of heme biosynthesis. So the third step is four molecules of porphyrinogen that forms hydroxymethyl. You can see this four molecules of PBG. They form hydroxymethyl in presence of enzyme hydroxymethyl synthase. So if this enzyme is deficient, that leads to acute intermittent porphyria. The features are abdominal pain and neuropsychiatric symptoms. So if this enzyme is deficient, PBG cannot convert into hydroxymethyl. So ALA levels and PBG levels, both they are found to be increased in blood. Next is congenital erythropoietic type of porphyria. This is autosomal recessive type of porphyria. This occurs due to deficiency of enzyme uroporphyrin 3 synthase, and this uroporphyrin 3 synthase is required in step 4 of lead biosynthesis. So hydroxymethyl is converted into uroporphyrin 3 in presence of enzyme pyroporphyrin 3 synthase. So if this enzyme is deficient, that leads to a porphyria called congenital erythropoietic porphyria, and this is autosomal recessive condition. So photosensitivity is the clinical feature, most important clinical feature of this porphyria. Next is Porphyria cutánea tarda. So this type of porphyria is autosomal dominant condition. It is hepatic type of porphyria and it occurs due to deficiency of enzyme uroporphyrinogen 3 decarboxylase, and this decarboxylase enzyme deficiency, this leads to Porphyria cutánea tarda. This uroporphyrin 3 decarboxylase is required for step 5. In step 5, uroporphyrin 3 is converted into coproporphyrin 3. So if this is deficient, that leads to Porphyria cutánea tarda. And the most important clinical feature is photosensitivity. Next type of porphyria is hereditary coproporphyria. So what is hereditary coproporphyria? So it occurs due to deficiency of enzyme coproporphyrinogen oxidase. So where it is required, copper oxidase is required in step 6 of heme biosynthesis. So what is step 6 of heme biosynthesis? Coproporphyrin 3 is converted into protoporphyrin 9 and the enzyme required for this reaction is coproporphyrin oxidase. So if this enzyme is deficient, that leads to a disorder of porphyria called hereditary coproporphyria. So the clinical features are photosensitivity, abdominal pain, and neuropsychiatric symptoms. Next type of porphyria is variegate porphyria. So it is hepatic type of porphyria. It is autosomal dominant condition and it occurs due to enzyme deficiency in step 7 of heme biosynthesis. So the enzyme required for step 7 is protoporphyrin oxidase, which catalyzes conversion of protoporphyrin 9 into protoporphyrin 9. So if this enzyme is deficient, protoporphyrin 9 cannot be converted into protoporphyrin 9. So that leads to variegate porphyria, and this is a hepatic type of porphyria and autosomal dominant condition. So the clinical features are photosensitivity, abdominal pain, and neuropsychiatric symptoms. Then, what is protoporphyria? Protoporphyria is a type of erythropoietic porphyria. It occurs due to enzyme deficiency. Last step, step 8, ferrochelatase. So, ferrochelatase enzyme is required for formation of heme. So, iron Fe2 plus it combines with protoporphyrin 9 which is formed in step 7. So protoporphyrin 9 it combines with Fe2 plus that is iron in presence of enzyme ferrochelatase to form heme in heme biosynthesis pathway. So if ferrochelatase is deficient, that leads to a condition called protoporphyria, and the clinical feature is important clinical feature is photosensitivity.